How many of you are pre-op? Okay. And how many of you have the surgery? Raise your hand. Oh, we have a nice mix. Very good. Okay. Are any of you just out like, a couple weeks?
I'm 6 weeks out.
6 weeks. Fantastic. How much have you lost?
29 pounds since surgery, and then pre-surgery it's been 47.
Congratulations. Which procedure did you have?
I had the gastric sleeve.
Okay, terrific. Okay, very good. Congratulations. All right. Is anybody having surgery soon in like a week or two? When is your date?
Monday.
Monday. We'll be thinking about you. Are you excited? And how about you? When is your?
I said I'm Monday also.
Oh my goodness. So John's going to be busy Monday. Okay. Good. We have some people lined up for you. We don't want you to get too bored. So God forbid, right? Okay. Today's topics are going to be about jealousy and self-esteem, and you may wonder, how in the heck do these two things even go together? Well, they do. So we'll be tying them in. But the reason that we chose these are that someone really brought up this topic of jealousy in the last support group, and that so I thought it'd be something important to talk about. It's something that can definitely interfere with goals, which is also your weight gain, weight loss, those kinds of things. First thing that we just want to define is, what is jealousy? So I'm just going to open it out to you all. What is jealousy? How would you define it? And by the way, we all feel it. It's a normal feeling. If you tell me you've never felt jealous in your life, I don't know if I believe you, okay? Or either that or you may not recognize it, so.
Is it wanting something you don't have?
Very good. Wanting something you don't have. Excellent. What else?
Something that somebody else has.
Okay, wanting something that somebody else has. Does it feel good? Not usually, right? Is it always destructive? Can it ever be helpful?
Yeah.
How can it be helpful?
Be motivated.
Yeah.
Okay. And tell me in what way, how can it motivate you? To reach a goal? Okay. Can jealousy ever be helpful in a relationship? And even a friendship. Let's not even talk about it intimate. Never. You might think of a time where, in a way that it might, because actually, I'll give you the answer, that it actually can be sometimes constructive. To a certain point.
Well, it helps you see yourself as you are.
Okay.
You
Okay.
make changes.
Okay, so it can be a mirror. Very good. If you look at it that way, if you're willing to look at your behaviors and not become
Most of us will.
yeah, and not become defensive, right? It's very hard to look at ourselves sometimes with a lot of honesty. People often don't think about this, but every now and then, if your partner says, I'm a little jealous that you're talking to so-and-so, and it's minor, kind of makes you feel good, doesn't it? He loves me, or she loves me, or, sometimes even I had, a girlfriend of mine, I'll ask her to go to the coffee, and she'll say, well, I have, plans that day with someone else, and I'll be like, oh, you do? You mean you have other friends other than me? And it might be on a low self-esteem day that I'm feeling that, but sometimes it lets us know that someone cares about us, as long as it doesn't go to the extreme of being destructive, so which I'm going to talk about in just a second. So types of jealousy in a romantic relationship. One is suspicious, and that's really where self-esteem usually comes in. These are individuals that, often are paranoid and can really be destructive unless you got to get a hold of it in a relationship. And then the reactive is where it is based on some evidence. And sometimes in relationships, you got to follow your gut. And sometimes when I'm doing couples therapy, and one person's cheated on the other, and we're in a session, I'll say, were there any signs? And they're like, no, I didn't see anything. And if you push them a little bit harder, they'll be like, well, there were a few things. I mean, they were staying at work late, and this was a little odd, but I didn't really, I didn't really think it much of it. Usually, and you don't want to be too, sometimes people do have to work late and things like that, so you don't want to be too paranoid. But usually there are signs. Usually something is up, and most of the time people just don't want to see it, and they hope it just goes away. So you have to really judge, and it's a fine balance between when do I follow my gut and kind of bring this up in a relationship, and when is it really me being just a little bit too reactive. So it can be really difficult. So you have to kind of, balance that or get some support, run it by friends, that kind of a thing. All right. What type of person usually feels jealous?
Insecure.
Yeah, very good. That's exactly right. You guys are too smart, my gosh. Okay, so that's exactly right. So these are usually people that feel insecure about themselves, and that's how that ties into low self-esteem. That's absolutely right. So how would you describe low self-esteem? What is low self-esteem?
Not liking yourself, not loving yourself.
Okay.
You're good.
You're not good enough, not liking yourself. Are your thoughts positive usually, or not really, right? Okay. All right, so self-esteem is sometimes very hard to define. It's really, really broad. It doesn't mean that you feel good about everything about yourself, but that you are probably willing to look at your faults and work on them, but also realize that you have strengths, right? I mean, we're all human. So here are some of the effects of low self-worth. It really affects our interpretations and perceptions. We distort, right? So when we're having, and listen, we all have them. When I'm having a low self-esteem day, and every now and then I might see two people or colleagues at work talking at the corner of the room, I'm thinking, they're probably talking about me. And I'm able to catch myself because I'm aware of that. But it's normal. So I want to normalize this for you from my experience, that it happens to all of us, okay? So we definitely distort things. We become paranoid. Our expectations of self and others, do they become high or do they become low? Are people with low self-esteem highly critical or not?
Yes.
Very much so, of themselves and others, and really demanding. That's exactly right. And when people don't meet their criteria or their expectations, they really often fall into a depression or get very angry or demanding, and are not okay with letting other people have flaws and be human. Ambition and motivation. So this is where it ties in really with you all and weight loss goals and health. And you all know this, right? So you are not really happy with your weight and where you're at, and so you get depressed, your self-esteem goes down, and then what do you do to self-medicate?
Eat.
That's exactly right. And eating works beautifully, doesn't it? It raises a neurochemical in our brain called dopamine, which makes us feel good. People that smoke cocaine, dopamine goes higher in our brain. Food is it's an addictive drug. I mean, again, I'm not telling you anything you don't know, right? So that's why self-esteem is so important to work on, and being able to make it through those emotional tough times without self-medicating through those kinds of things. So do you care enough about yourself to reach your weight goals? If you are post-op, making sure that you don't gain the weight back, because it's easy to do if you don't follow the plan. All right, so when and how does self-esteem develop? So I gave you a little hint. During what period of our era of our lives?
Formative years.
Yeah, childhood, usually childhood. And for those of us that grew up in a very loving home, we were lucky enough to do that. Oftentimes we develop good self-esteem. For those of us that didn't, and I'm going to give you kind of a chart where it kind of breaks down a little bit. Did you or did you not get this when you were growing up? And if you did not, sometimes that's where some of your struggles as an adult can come from. So if you're given love and support, and that means unconditional love and support, that usually makes someone feel I'm adequate no matter what. No matter what weight you are, no matter, if you are performing, or if you're a doctor or a lawyer, or you are, collecting garbage, whatever that is, you're okay with that because you learned as a child from your caretakers that I'm okay no matter what, right? Not all my behaviors aren't okay, right? It's not okay to throw a tantrum, but my parents still loved me despite that. Not all of us got that, and that has repercussions often into adulthood. Treated with respect as a child, also, that you are acceptable no matter what. Were you given encouragement? Were you encouraged, again, feeling that you are lovable no matter what? Okay? Valued, feeling worthy as a human being, and also worthy of reaching your goals and getting support and reaching out for support if you need it. Receiving affection, being competent, and listened to. So, and childhood doesn't have to stay with us into adulthood. As long as you become aware of that. And some people are able to, they just overcome their childhoods, no problem. Some people struggle with it a little bit more. If you're not aware of negativity in your environment, that saber-toothed tiger will eat you up alive, right? But to be aware of the positive, that may or may not help you survive. And so we have kept that sort of survival instinct in us into modern day. We don't really need it anymore. Not to that sense. We do when I'm driving on the 405, let me tell you. I need it then, that's for sure. But most of the time, it would be nice if we were wired to be more focused on the positive, but unfortunately because of survival, we are more focused on the negative. And so you have to work at, I like what you said, if I could only remember to think of the positive things. And that's why staying positive is work. And that's why psychologists will never be out of work. Because it's really hard to do that. Because we tend to default to the negative often. And no matter how good your self-esteem even. I mean, again, everyone does it. Everyone's human. So oftentimes we think, everything will be fine when I'm a certain weight. And it doesn't happen, does it? Right? Even though it's true that employers discriminate more out there in terms of weight. But that doesn't necessarily mean that because you lose the weight, you're going to find a job like that. I mean, especially in this economy, right? And so you have to really be careful in terms of that magical thinking. Or if you had marital problems before the surgery, they're probably not going to go away just because you've lost weight. And sometimes they even get exacerbated because one of the partners might get jealous or there might be some issues there. So it's really important to focus on, there's a lot of positive about the surgery. I mean, lots of it. But also, life goes on, So, and there's always this magical time. It's always right after the surgery. For those of you that are post-op, is that true? There's a magic, it's like right after surgery, the weight just melts off and you are on cloud 3 million, right? And then life, 3 what?
3 months.
3 months. And then life starts happening again, doesn't it? Right, that's right. And the same issues, and maybe you're not losing as quickly, and so you have to make sure and watch that magical thinking. I mean, you want to be happy about your weight loss, but it's not going to solve everything. So unfortunately, wish it could.